Ontario's air ambulance service was supposed to be the envy of the world. Now, as the Auditor General's report on Ornge lands at Queen's Park, that's in tatters and taxpayers are left holding the bill.
The ministry didn't do its job in making sure that taxpayer interests were protected.
The auditor found a web of questionable deals, like a complex scheme where Ornge bought flashy headquarters in Mississauga, then leased it back to itself at an inflated rate, intending $9 million in profit to flow to one of its subsidiaries. Bottom line, the government wasn't watching.
There is a lot of blame to go around here, and I think all of us have to learn from this.
Where Health Minister Deb Matthews wants the blame to go is to the performance agreement with Ornge, signed by her predecessor, George Smitherman, and to Ornge executives like former CEO Chris Matza, who was making $1.4 million a year.
We saw the appearance of possible self-interest that we questioned whether was appropriate. And hence, that's where we went to the ministry and said to the watchdog, this doesn't pass the smell test.
Among the auditor's findings, funding for Ornge went up 20% in its first 4 years, even though the number of patients being transported went down by 6%. When internal analysis suggested buying 9 helicopters, the board at Ornge approved the purchase of a dozen, and then put seating in 2 of them so they couldn't be used to transport patients. The taxpayer is on the hook for those decisions. Matthews must go, says the opposition.
It's very clear that the minister did not do her job.
This Minister of Health cannot credibly lead change in our healthcare system.
For her part, Matthews refuses to resign, saying she's focused on fixing the problem.
Of course, this story is far from over. The OPP criminal investigation continues into financial dealings at Ornge. The auditor himself saying he's 99% sure he hasn't even found all the shell companies and subsidiaries set up by the former leadership at Ornge. So we have tens of millions of dollars of taxpayers' money not well spent, no oversight by the government, and the possibility, the very real possibility, of patient safety being compromised. Some very tough days still ahead for the Minister of Health. Leslie?
Very damning report indeed. Ellen Carter at Queen's Park. Thank you.